Yeah, well, I know that the results of the MOST trial will be released. That's a multi-center NIH-funded trial that was conducted through the StrokeNet that was looking at the utility of adding an anti-thrombotic agent with thrombolysis, alteplase or tenecteplase in the treatment of acute ischemic stroke. This was a trial that many large centers were a part of, and I think it's a question that people have had for a while, so I think we'll finally get an answer. I'm looking forward to hearing the results and seeing some of the details. There's a few trials that are being presented looking at the effects of middle meningeal artery embolization in patients with subdural hematomas. That's kind of on the fringe of stroke, but an important disease that often vascular neurologists, stroke neurologists treat. And there aren't great treatments. And I think if we had something less invasive than surgery that was effective, I think that could be really helpful for our patients. So I know the Embolize trial, the surgical arm of that trial, will be presented by actually my colleague at Cornell, Jared Notman. So I'm looking forward to that. And, in the conference, you get to see some of the secondary analyses of recently completed trials, so you can learn about, some of the nuances with these trials and the data and which subgroups, may benefit or not benefit as much. I know the Arcadia trial that was presented at a prior conference is going to have some secondary analyses presented at this year's ISC. One study that I know will be presented at the ISC is a secondary analysis of the BEST MSU trial, which was a trial that compared pre-hospital care by mobile stroke unit and treatment and diagnosis of stroke in the field versus standard emergency department treatment of stroke. That trial, the primary analysis, have previously been published in New England Journal of Medicine, demonstrating that mobile stroke units are associated with better outcomes, better functional outcomes. But at this ISC, a collaborator of mine, Alexandra Zapp, she's presenting on the effects of mobile stroke units in relation to race and ethnicity. I think mobile stroke units are a technology that can help eliminate disparities. I think if mobile stroke units proliferated and were used, more broadly throughout the country, they could treat people with stroke of all backgrounds in the field about 30 minutes faster than standard treatment through the ED. And I think it could help minorities in particular.